Hi, good afternoon, good morning. Welcome to the DNPAO seminar series. Super excited for the seminar that we have for you all today. It's going to focus on the 5-year impacts and stories from the field from our state physical activity and nutrition program, our high obesity program, and our racial and ethnic approaches to community health. So thank you so much for joining. I'm Janelle Gunn. I serve as the Associate Director for Policy, Partnerships, and Communications, and today I serve as your moderator for our seminar series, so really glad to have you with us. Just a few housekeeping things for using this platform. All of your lines are muted. We do want to hear from you, so if you have questions, go ahead and type them in the Q&A chat box. We'll get to those at the end of the seminar today, but feel free to enter them at any time. Also, the seminar is being recorded. This will be available later for playback on our website. So I'm super thrilled about the seminar that we have today and the great stories that we have to share with you all today. So we have an all-star lineup of presenters. First, we have Terry O'Toole. He serves as our chief for the Program Development and Evaluation Branch in CDC's Division of Nutrition, Physical Activity, and Obesity, which we finally call DNPAO. He provides leadership and subject matter expertise to state and community-based programs, national partners, and health organizations focused on program efforts to promote good nutrition, physical activity, and obesity. Next, we have Anu Pejavara. She serves as our program evaluation team lead. And in this role, she's the lead for program evaluation for the division. She and her team guide 83 state and community recipients to evaluate policies, systems, and environmental change strategies to improve physical activity and nutrition environments. Her utilization-focused approach allows evaluations to be grounded in community context and be used for data-driven decision-making. And you're going to hear more about that today. Next, we have Catherine Bernstein. She's the program director for food systems and nutrition policy with the Illinois Public Health Institute. In this role, she works to increase access to nourishing foods in workplaces and community spaces by managing the food service guideline strategy of the prior CDC State Physical Activity and Nutrition Cooperative Agreement. Catherine is also involved in food systems, legislative policy, and coalition development initiatives. She'll be followed by Yolanda Pruitt. She serves as a program manager for Mississippi State University, the high obesity program there. She served as that program manager, and there they also call their project Aim for Change. Through this partnership with Mississippi State Extension, she enjoys coalition building and community engagement in rural communities and credits her experience and associated leadership roles there as giving her a solid foundation for her public health career. And then next we'll have Michaela Hill. She's the Nutrition Health Promotion for Multnomah County REACH, the Racial and Ethnic Approaches to Community Health program there. In her role as specialist, she has partnered with over 20 community organizations and has a team that addresses food access barriers and affordability concerns among Black and African immigrant and refugee communities. She is also involved in advancing food policy and system change to influence the institutions and settings that shape the way we eat and our long-term health outcomes. So as you can see, we have an awesome panel for you all today. So here's our plan for the next hour. We're going to hear about the 5-year impact for the STAND, HOP, and REACH programs. Then we'll hear from the Illinois STAND program and some of their work in food service guidelines. It'll be followed by physical activity through community design from the Mississippi State University HOP program. And then we will have the Reaching the Black and African Community, expanding culturally specific breastfeeding services focused on the work of Multnomah County REACH. Lastly, we will close with Q&A, so another reminder to go ahead and submit your questions throughout the presentations today. All right, I'm pleased to hand it over to my colleagues, Terry and Anu. Terry?
Thank you, Janelle. Hello, everyone. I'm Terry O'Toole, and I lead our DNPAO program and evaluation efforts to translate what we know works into public health strategies that can build a nation where everyone can easily access nutritious foods and lead active lives. However, more than half of Americans live with at least one chronic disease, such as heart disease, diabetes, or obesity. And we know that chronic diseases are the leading causes of death and disability, drivers of healthcare costs, and lower worker productivity. And the two main risk factors for chronic disease include inadequate physical activity and poor nutrition. So adequately addressing these risk factors needs to consider longstanding inequities, factors that influence health, and leveraging partnerships with federal, state, and local public health agencies and non-governmental organizations, as well as education, transportation, agriculture, housing, and healthcare sectors and settings. This next slide depicts our DNPAO leadership and how we are organized to achieve our mission to support healthy eating and active living for all people by advancing public health strategies that work. We have an amazing team of public health professionals across DNPAO, and we know what works to build healthier communities. And DNPAO uses information from research studies, recommendations from expert bodies, and practice-based experiences to determine what works best and what public health actions are feasible and impactful. DNPAO has identified and prioritized 5 population-focused public health actions to reduce chronic disease through improved physical activity and nutrition. Number 1, being physically active is one of the most important things people can do to improve their health. And DNPAO provides funding and technical assistance to help states and communities make physical activity safe and accessible through a variety of activities, such as complete streets policies and supporting safe routes to schools and parks. Number 2, actions that work to make healthy food choices available include healthy food guidelines and procurement policies where food is offered, served, and sold, and increasing access to fruit and vegetable voucher incentive and produce prescription programs. Number 3, states and communities can enhance maternity care practices in hospitals to support the start for breastfeeding, and after leaving maternity care settings, can promote access to culturally tailored breastfeeding support in the workplace and community to help sustain breastfeeding. And number 4, DNPAO provides funding and technical assistance to state and local recipients to develop action plans that can use system and policy levers to improve nutrition, physical activity, and breastfeeding environments in early care and education facilities. And number 5, DNPAO provides funding and technical assistance to states and communities to make it easier for families who need access to CDC-recognized family healthy weight programs proven to support healthy growth and reduce chronic disease. At DNPAO, we know that state and local health agencies need focused resources and specific expertise to tailor and implement these actions that work. It also takes essential and specialized staff, including physical activity specialists, public health nutritionists, program evaluators, policy experts, communication experts, epidemiology and operations support, as well as a dedicated project manager. And over the last 5 years, DNPAO provided funding and technical assistance to 16 states, 15 land-grant institutions, and 40 organizations to implement what we know works through our SPAN, HOP, and REACH public health programs. Please refer to the link just in the chat there depicting our current round of recipients. And I'll just close my comments today by sharing 2 key takeaways from what we know about our work to reduce chronic disease through improved nutrition and physical activity. Number 1, our supply is not even close to meeting the demand. That is, DNPAO resources equivalent to 31 cents per investment per American per year may be unlikely to prevent at-risk Americans nor reduce the racial and ethnic disparities in the national burden of obesity. And number 2, when we do fund states and communities to implement what works, they are incredibly successful. You'll hear about that more, and I'm pleased to turn it over to my colleague Anu Pejavara and our friends from Illinois, Mississippi, and Oregon who will share more highlights on the impact of our SPAN, REACH, and HOP programs.
Great. Thank you, Terry. Appreciate it. What a privilege for me to be with you all today. My name is Anu Pejavara, and I lead our division's program evaluation efforts for this work, as Terry mentioned, and I get the great honor today of sharing the collective impact made by SPAN, REACH, and HOP recipients over the 5 years of 2018 to 2023. These 71 state and community partners demonstrated such a commitment to making a difference in our country's efforts to improve places and to ultimately make the healthy choice the easy choice. Honestly, we have been truly wowed by them, so I am proud and honored that I get to share a little bit of their work. So what I'm going to do is I'll start by describing our approach to the evaluation design and then share the findings with you. So the first purpose of our evaluation design was to demonstrate accountability for this funding. So what this looked like was rolling up the data and sharing it internally and externally. So each program year, what we did over the past 5 years is we disseminated mid-progress findings to CDC leadership, to our recipient partners that were doing this work out in the field, and other key partners. The second purpose was to collect and analyze evaluation data to ensure we were providing high quality technical assistance and guidance to our recipients. So over the 5 years, what we did, there were so many instances actually where the data really helped illuminate gaps and opportunities that we were then able to address in real time to improve the quality of programs. And thirdly, we wanted to use evaluation findings to help advance the field of nutrition, physical activity, and obesity prevention. You know, what's really exciting is although it wasn't even a requirement of these cooperative agreements, more than half of our SPAN, REACH, and HOP recipients published peer-reviewed articles in journals describing and showcasing their work, which was just so exciting to see. So we had several principles that were kind of our true north and guided us in our evaluation design. First, as I mentioned, we made a commitment to routine data collection and dissemination so that we could make timely decisions along the way of the cooperative agreement instead of waiting until after it was done. A second principle we used was transparency. We heard from recipients in the past that there were sometimes when they reported their data to CDC and they were unsure of what happened to it or how those data were used. We aim to be transparent with recipients every step of the way. We pulled back the curtain and openly shared the details of our review, validation, and data cleaning process. And then we made a commitment to hold an annual webinar where we shared their findings back to them, back to the recipients. And we shared it by strategy, by cooperative agreement, and by the full portfolio. And, you know, it was really great to hear after these presentations that we did each year, many recipients would reach out to us and say how much they appreciated seeing how their work contributed to this overall collective mission that we were on. In fact, that's basically what we're doing here with you all today. So I'm sharing first the high-level findings of the full portfolio of 71 recipients, and then the 3 recipient partners that are going to share after me, they'll share how their work was part of that overall success. So the third principle you see here is usability. We really thought a lot about that when designing our evaluation. For each component of evaluation, we were really clear on how the data would be interpreted and used. Simply put, if we didn't intend to do something with it, we didn't collect it. Fourth, we co-created our evaluation design in partnership with recipients. We first drafted some guidance internally, and then we would ground truth it by asking our recipients about the feasibility of that work. Was this relevant to their context? Would this create an undue burden on them for this reporting? So we asked those questions so that they could be involved in the design. And finally, we all here know that context matters. What recipients do in their states and communities is driven by the needs of their specific priority populations, and they tailor their approaches to meet those needs. We tried to build a mixture of evaluation reporting that allowed for rolling up the data to tell this portfolio level story, while also allowing recipients to describe and showcase the unique context of their programs. So we spent a couple minutes here just talking about the purposes and principles of our design. Now let's discuss how we collected this information and what we found from it. So we used a mixed methods approach in our evaluation design. Today, I'll highlight 3 portions of our evaluation data collection. We'll start with the first, which was a qualitative method, and then later I'll discuss the 2 quantitative methods. So starting here, you see contextual questions mentioned. Each year, we asked recipients a few open-ended questions in their evaluation reports that gave them an opportunity to share their unique context with us and informed how we approached the work or what the work meant to them. So allow me to share just a few themes and quotes from the final year's reports of recipients to help explain a little bit more about what this work meant to them, how they use their evaluation data, and how this has made an impact on them and their communities. So one theme that emerged when reviewing these reports was how SPAN, REACH, or HOP helped recipients to develop partnerships and expand and foster the ones they already had to advance this work. And importantly, in this example quote, you can see that these partnerships help them reach priority populations, many of whom are often the most vulnerable and underserved in our country. And this work and these partnerships help them optimize the limited resources dedicated to physical activity, nutrition, and breastfeeding. We know that the evidence-based actions that Terry mentioned earlier are most effective when they can be tailored to the needs of priority populations or community context. A theme that arose from our recipients' narratives was how much they appreciated the opportunity to make their work responsive to their community's needs, assets, and cultures, instead of applying a one-size-fits-all approach. As I mentioned earlier, we sought to make our evaluation reporting very usable, not only for us, but for recipients. Many recipients noted the numerous ways they were able to use evaluation reporting for themselves and for their partners. Let me just highlight two themes about that. One was related to using evaluation data in real time for continuous program improvement. In this example quote, the recipient modified a breastfeeding certification program goals to better address structural barriers following evaluation data. Other recipients noted that evaluation data helped them realize certain priority populations were not being reached or certain program goals were not being achieved. The other way recipients used evaluation data was when putting together applications for additional or future funding. This recipient said that potential funding partners are more inclined to provide financial support when they receive concrete evidence of the impact of a program. They felt their programs were strengthened with evaluation data, providing, quote, a powerful advocacy tool when making the case for continued support and expansion. Other recipients noted that these data were critical in demonstrating readiness to implement new programs, or by highlighting the leveraged funds they had already secured, they could showcase that they have a proven track record of using outside resources to enhance program activities. So that was just a few snippets from evaluation reports. Now let's shift to talking about the two quantitative data sets we have. We'll start with leveraged funds. So the way we define leveraged funds are the financial representation of resources, goods, or services from a source other than DNPAO. We know that securing leveraged funds can amplify current program efforts and help establish a foundation to sustain future efforts beyond the current funding period. Tracking and reporting leveraged funds can help communicate the value of span, reach, or HOP efforts to decision makers, partners, and community members. And this works really great for both the recipient as well as for CDC. So not only did span, reach, and HOP recipients use their federal resources effectively and efficiently, they collaborated with partners to leverage an additional $400 million to amplify their funded strategies and help sustain their programs beyond the funding period. On this slide, you can see the breakdown of the amount of leveraged funds by cooperative agreement and the number of recipients per cooperative agreement. So just to highlight a couple of notes about that. So the SPAN program, which primarily represented statewide entities such as state health departments, had the ability to leverage more dollars from other federal resources or from state budgets, which led to a greater total relative to the number of recipients. So for example, state health departments were able to collaborate on and get resources from other state level entities, such as the Department of Transportation, Departments of Natural Resources, maternal and child health programs, and university systems. And just to demonstrate the contrast, HOP recipients had an expectedly lower overall total of leverage funds due to working in primarily rural communities with smaller populations and fewer resources. But really, across the board, we saw incredible amount of funds leveraged, and the recipient's ability to successfully do this from various sources really suggests that this work in policy systems and environmental approaches could really be sustainable. Finally, let's share the impact recipients demonstrated via their annual performance measure reporting. Our performance measures quantify the number of settings that provide increased access to opportunities to make healthy choices and the number of people potentially reached through those efforts. Places and people. Honestly, we have more data than we have time to cover today, so we're just going to share the impact recipients made on people through their 5-year efforts. So allow me to walk through these circles one by one, starting from the top left. Let's start with the physical activity strategy, which is impacting a whopping 28 million people. State and community recipients passed new or improved policies or plans to increase activity-friendly routes to everyday destinations. Now, because of this great work that happened over the course of 5 years, there are more sidewalks and bike lanes in their communities and more everyday destinations where families can be active. Looking at the second circle, through the work recipients have done to implement healthy nutrition standards in places where foods are sold, served, or distributed. These are places like food pantries, work sites, hospitals, government buildings, colleges, and universities. Through this work, 9 million Americans have increased access to healthier foods. Breastfeeding. Continuity of care, as Terry mentioned earlier, is achieved by consistent, collaborative, and seamless delivery of high-quality services for families from the prenatal period until no longer breastfeeding. Over 3 million mothers and families can get the skills and support to breastfeed from the prenatal period to the time of delivering their baby in the hospital. So when they're establishing breastfeeding in their daily lives, in the work site, in the community, or in early care and education centers. 2.6 million people have more options for places to get healthier food through increased or financial or geographic access. Recipients worked on enhancements to existing places to accept food incentive vouchers, such as SNAP, the Supplemental Nutrition Assistance Program. They also worked to increase neighborhood availability of healthier foods through mobile markets or adding new farmers markets or adding new food pantries. Many of these places are helping families with food insecurity get access to fruits and vegetables at low cost or no cost. Moving to the bottom row, 3.8 million children are attending early care and education, where nutrition, physical activity, and breastfeeding standards and practices are now being improved thanks to this great work. A few REACH recipients worked in the tobacco space. Some of them worked with partners to pass local tobacco policies, which were those that were implemented at the jurisdictional level. So they had the potential to influence an entire city or county. Thanks to this work, 1 million more employees can breathe a little easier, knowing that their environment and their work site is tobacco-free. And finally, over 41,000 patients have been referred to much needed care for chronic disease prevention or management, or to other services for job assistance, housing help, or mental health, treating the whole person. This is the impressive impact that SPAN, REACH, and HOP recipients made in their states and communities over the course of 5 years. We are so grateful for their impactful contributions that they made, and we've really enjoyed our partnership with them. So speaking of partnership, we're now going to be hearing from 3 of those recipient partners. So I'm going to first turn it over to Catherine Bernstein to share about her team's work in Illinois. Catherine.
Thank you so much, Anu, and thank you all very much for having me. My name is Catherine Bernstein. I use she, her pronouns, and I'm a program director working on food systems and nutrition policy with the Illinois Public Health Institute. I led the food service guidelines strategy from the last Illinois State Physical Activity and Nutrition, which we called ISPAN program from 2018 to 2023. And today I'll share a little bit about our impact in the food service guidelines space. So first, I mentioned I'm with the Illinois Public Health Institute. We are a statewide nonprofit whose mission is to mobilize stakeholders, catalyze partnerships, and lead action to improve public health systems, to maximize health equity, and quality of life for people and communities. The Illinois Public Health Institute was the implementation agency for the last Illinois SPAN program, as well as the new SPAN Cooperative Agreement, which will run through 2028. And of course, much of the work for SPAN was and will continue to be done by our incredible program partners. So we and our food service guidelines partners are so grateful and humbled by the work that we were supported to do and the people we had the opportunity to impact. Over the course of the last SPAN program, Illinois supported 50 work and community sites to tailor, formally adopt, implement, and to monitor food service guidelines. These sites included food pantries, transitional and supportive housing facilities, a park district, local government departments and agencies, Special Olympics Illinois, and many more. Collectively, these 50 sites fed 224,649 Illinoisans. So to help us wrap our minds around what this really looks like in practice, I pulled a few snippets from some of the guidelines implemented across the state. So you can see that Marillac St. Vincent Food Pantries is increasing their supply of health supporting foods that are requested by their clients via surveys. They're doing this by purchasing the items, requesting the items from donors, and seeking to establish new targeted donation relationships. Pekin Park District is making sure that there's at least one unsweetened fruit and or non-fried vegetable, one whole grain snack, and one non or low-fat dairy option at all of their concession stands across the district. The Riverbend Food Bank is growing their partnerships with local farmers, especially those who produce foods that are requested by their guests and who identify as members of their priority populations. Special Olympics Illinois is striving to offer a variety of meals and snacks inspired by a diversity of cultures, repeating a meal or snack offering as little as possible. The Cook County Juvenile Temporary Detention Center is offering free drinking water at all of their meals. The Tazewell County Health Department is including at least one vegetarian option every time food is served. And finally, the Hepzibah Children's Association is serving all of their children's meals on a MyPlate plate. So these are just bits of the 50 guideline documents that are now active throughout the state of Illinois. To further dig into what this looks like, these are a few pictures of the guidelines in action. So on the top left, you see some fresh fruit that are newly available to residents at Hand in Hand Transitional Housing. These were given out at each of the houses that they operate. In the middle, you see some health supporting snacks that the Peoria Area Food Pantry Network served at one of their events. On the top right, you see some fresh produce in a new refrigerator at the Daystar Food Pantry down in Southern Illinois. And on the bottom, slightly left of center, you see the snacks that we had at a taste testing event with the Illinois Committee of Blind Vendors. They took the snacks that they thought would sell well and incorporated them into their vending machines all across the state. So that's all I have. Thank you so much for your time. It's been an absolute pleasure doing this work in community with so many of you, and we are very excited about the work to come. My contact information is on the slide, and please don't hesitate to reach out anytime. And now I'm glad to pass it to Yolanda Pruitt with Mississippi State Hub.
Thank you, Catherine. Being active is an important part of living a happy and healthy life. The Bike Share program was a demonstration project to see how we could connect physical activity through community design. This project was yielded from the results of a transportation plan that we did in Noxubee County that included the city of Macon and the towns of Sugarlock and Brooksville. We had a total of 20 bikes that were distributed between the library branches of these towns and city. The collaboration with the Department of Rehabilitation was beneficial in providing a safety component with the helmets. With this project, we were able to connect over 15 miles throughout the communities that included projects such as the Story Walk and walking tracks. These are the collaborators that helped to bring this project to life. Having the municipalities engaged from the very beginning was instrumental in the planning and implementation phases. The small town center created the plan that handled most of the physical purchasing and the logistics. Noxubee County Library System will house the bikes and make them available to community throughout the checkout process, which they will actually check the bikes out like they check out books. MDRS, Rehabilitation, provided the helmets to each community, which again provided a safety component as well. Charles T. Brown is the founder of Equitable Cities and provided technical assistance through Centers from Disease Control. So if you're thinking about using technical assistance, I would tell you now, definitely take advantage of it. It was very helpful to us, and he was a great asset to our efforts. Not to mention, he was a native of Noxubee County, so we definitely hit a home run with that. These are some of the marketing tools that we use to introduce the project to the communities. We had a ribbon cutting event. We did flyers and cards at community events throughout the towns that we actually work with. We also did a promo video to be able to educate on the process for checking out the bikes, and the link should be in the chat. This was one of the many comments that show how grateful and empowered rural communities can be when you get the buy-in from them and include them early on in the process. The community was very excited about the project in the planning stages and throughout the early implementation. Once we implemented the program, they wasn't quite used as much as we thought they would be. However, it does exemplify room for growth, which we will give the community the momentum to get more people riding the bikes. And I'll talk about how we plan to do that as we wrap up in the next couple of slides. The next few slides show the routes that were marked by the Bike Noxubee logo in each location. Looking at these maps, you are able to see how the routes run through everyday destinations, such as the post office, such as food markets, such as schools, such as libraries, to name a few. So all of the places that they go on a regular is included in this bike route. And this actually shows Macon's route. And this shows Sugarlock's route. And this is the Noxubee bike logo to mark the routes that we use throughout the locations. These are some of the limitations that we've seen throughout the timeline. The outlook of the program shows that it was needed and it's promising. We plan to look at the culture to see how this plays a role in implementing this project and similar ones that we plan to do in the future. We plan to revisit why the bikes are not being utilized by possibly doing some focus groups or listening sessions to see the reasoning and provide that feedback to the community. We also are planning to work with the community to plan some events around the program, such as National Bike Day, to revamp the program. Some of the things that we got from the communities were liability. They were afraid if someone got hurt on the bikes. We kind of gave a suggestion of having a waiver in place so that they could sign the waiver before actually checking out the bikes. It also was some concern with maintenance. We actually suggested maybe doing a option where people can donate to the program. So provide $1, provide $2, and that can help with changing out tires and other maintenance issues that might arise. Also, working in small rural areas, it was an issue with storage and the assembly of the bikes. So we actually suggested, since the bikes could not be stored outside, that they take a look at other options where they can actually store the bikes, or maybe look into getting something a little bit more durable outside so that the bikes will be safe, or bike locks to actually go on the box. Also, political will. So looking at preference for the programs and the means to achieve it can also be a limitation to this actual program. Please connect with us. Our social media information will be in the chat. And I will now turn it over to Michaela Hill with REACH. Thank you.
Thank you, Yolanda. Hello, everyone. My name is Michaela Hill, and I serve as the Nutrition Health Promotion Specialist for the Multnomah County Health Department REACH program. We are based in Portland, Oregon, and serve the Black and African population of Multnomah County. And I'm here to share our work in promoting breastfeeding and how we're increasing lactation access for our focus population. So I want to give a brief overview of the demographic we serve in relation to the history of the state and Multnomah County. Portland, situated in the county, has about 6% Black population, and it's been this way for decades. The state used to have many sundown towns, and there's a history of hostile and discriminatory policies that have led to Black population stagnating and declining. Black and African people and the other non-white communities are often left out of decision-making. This, plus gentrification, has pushed a lot of our focused population, mainly the Black community, out of their historic neighborhoods of North and Northeast Portland and out towards Southeast Portland and Gresham. When it comes to breastfeeding, this is an issue because there is less of a community of practice around breastfeeding in the Black community. There aren't a lot of Black medical practitioners in the lactation field, and this is one of our underlying challenges. Now, particularly after the peak of COVID-19, people might have trouble finding culturally specific care, resources, and information because we still haven't fully transitioned back to in-person activities. Community building has slowed, and this is a constant barrier that we find ourselves going up against. So Multnomah County's REACH program is grounded in cultural preservation, building on strengths of the community to promote health equity using community-based participatory processes. We leverage partnerships, community voice, and resiliency while promoting social cohesion and economic development in order to counteract the toxic stress caused by socioeconomic inequity, racism, and forced displacement. Multnomah County REACH cultivates cultural pride and community connection. In Multnomah County specifically, Black mothers do initiate breastfeeding at a rate of 92% of white mothers, but only compared to white mothers, but only 55% of the Black African mothers who breastfeed exclusively still do so after 8 weeks, compared to roughly 70% of white mothers. Because of our partnership with WIC and the Healthy Birth Initiative, we learned that there are not many Black providers providing lactation support. Having culturally specific resources for new moms and families is crucial to their breastfeeding success. So the focus of our breastfeeding strategy was to increase continuity of care and community support among the REACH-focused population. Here we wanted to highlight some of our successes by sharing a few numbers. We assisted with 19 new and improved sites and programs. Over 32,000 residents were reached. 24 Black certified lactation consultants were trained. We partnered with 5 different health systems to support implementation of our 10 steps to successful breastfeeding and referring moms to culturally specific mobile lactation program called Sacred Roots. We launched an employee focused breastfeeding campaign. We also launched the Feed, Nourish, Love communications campaign, which I will share more images to that later, and supported the development of the Sacred Roots mobile lactation program so new moms can receive breastfeeding support in their homes, which was crucial during the COVID-19 peak. So this timeline here shows some of our activities throughout the 5 years of the REACH grant. I will share some of our notable successes, but I wanted to show the variety of activities we've implemented. Most importantly, we started by listening to our partners in the community to better understand the policy systems and environment in which Black moms were breastfeeding. From there, we worked with partners to address gaps in services, resources, and knowledge through a variety of policy systems and environmental changes. We launched a community campaign to promote and normalize breastfeeding, engage fathers, family, friends as support. We conducted barbershop talks to hear from Black men about supporting breastfeeding women in their lives. We launched the Feed, Nourish, Love campaign during COVID. We developed a mobile breastfeeding tent to be used at community events. We supported the training of 24 CLCs. We rebirthed ABCO, which is the African American Breastfeeding Coalition of Oregon. We advocated for a breastfeeding space at Rockwood Market Hall, resulted in 2 spaces, and we partnered with the Portland Airport to enhance lactation spaces. And every year we held special events to celebrate Black Breastfeeding Week within Breastfeeding Month. So how we do this work programmatically in the Multnomah County Health Department with Women, Infants, Children, and Healthy Birth Initiative, and with local community organizations such as Black Parent Initiative, Right from the Start, Sacred Roots, African American Breastfeeding Coalition of Oregon, and I Am More Resilient. We also work with other entities like the City of Gresham Redevelopment Commission and the Port of Portland. Some of our partnerships go back a few years and others are relatively new. We think it's important to work with organizations and programs that have history, are trusted in the community, or are notable and can help push our message out to the public. We're particularly excited to work with the Port of Portland this summer on a breastfeeding campaign to increase awareness and promote the creation of lactation spaces. Another success we wanted to highlight was our partnership with the African American Breastfeeding Coalition of Oregon, or ABCO. This coalition was paused for several years, but was eventually reconvened through the REACH activities and partnerships, focusing on policy systems and environmental change. We worked on starting their own 501(c). The CLCs are members of the ABCO that we certified, and we are assisting communications campaign within this coalition. We wanted to specifically highlight ABCO because this coalition is made up of several entities, and we work together to set goals and carry out our work. ABCO is made up of the Multnomah County Health Department, HBI, Healthy Birth Initiative, Women, Infant, and Children, BPI, Black Parent Initiative, Right from the Start, and Sacred Roots. Rockwood Market Hall. Now I'd like to discuss one of our successes in more detail, which was creating a lactation space in outer Southeast Portland or Gresham at a place called Rockwood Market Hall, which is a hall for BIPOC vendors specifically. More and more of our REACH focused population is being dispersed and pushed out of Portland proper and into the Gresham area. So we wanted to highlight that we did implement a breastfeeding space. It's newly built. It has restaurants, shops, a playground, a splash pad, and adding a lactation space makes it that much more accessible to families. And the lactation room allows nursing parents to have privacy and calm to nurse while out. Fathers as well as mothers are encouraged to use this space. It can also provide as much respite for children and people with neurosensory disorders. So REACH and ABCO partnered with the City of Gresham redevelopment team for this space, and it includes, and we like to call it a feed, pump, and rest spot. And this beautiful, and the slide's missing, but there's a beautiful, our lovely lactation station in partnership with ABCO that we bring out to provide at different events that is not a bathroom, a hot car, or uncomfortably dealing with public stairs. So we set those up at all of our events throughout the summer. There is that slide, sorry. And there's the beautiful tent. There's our 24 Black CLCs we like to talk about and highlight, of course. And then there's the Rockwood Market Hall lactation space being used by a father there. So here is a photo of the Mama Bob pod that we implemented last month at Soul Restoration Center, which is housed within the location of the former Albina Arts Center, and was established in the 1960s after Black youth advocated for a safe gathering space where they could take free creative arts, dances, and music classes taught by Black professionals. So I Am More is an organization that hosts the Soul Restoration Center. The space was intentionally created as a culturally relevant environment of social emotional safety. This includes round tables, padded chairs, sectional couches, lots of local art, colorful rugs, cultural books, water features, drums, meditation area, empowerment quotes everywhere, a fireplace for ambiance, incense diffuser love, and now a designated breastfeeding space that is listed on the Mama Bot app as a public space to breastfeed. So as part of Portland International Airport's ongoing efforts to provide a wonderful customer service experience, PDX opened 2 new lactation rooms, making 4 rooms total available to both employees and travelers. Each room is equipped with ample counter space, electrical outlets, chairs, a sink, additional seating for children, and a task chair. In addition, the rooms are decorated with soothing colors, lighting, and artwork. All 4 rooms are ADA compliant accessible, and we have developed the lactation room evaluation to enhance these spaces, and we plan to incorporate messaging and communications material that we will be used in various settings throughout the airport, as you see here, which we like to highlight. We do not want to eat our lunch in the bathroom. Our ABCO team has worked very, very hard on this, so this is one of our dear projects that we are proud of. So here's a flyer from our Breastfeeding Month activities and webinars. We asked all of our photos be utilized with all the mothers that are present in ABCO. So this is a poster we used to advertise a webinar we hosted during the COVID-19 pandemic when we were physically distancing. It shows the multi-sector partners we work with. And this was one of many postings for our Feed, Nourish, Love campaign to normalize breastfeeding. It shows a local woman feeding her infant on a bus stop bench. This was recently posted on our Reach Facebook page with tips for breastfeeding moms when traveling. And thank you. And I will pass it back to Janelle.
Thank you, Michaela, and thanks to all our presenters. So great hearing all the work that you've done over the past 5 years. If I can invite my presenters to come back on camera, we'll try to squeeze in a few Q&As here before we do some final thoughts. So if I can maybe turn the first question to Anu, what are some examples of leveraged funds recipients secured?
Yeah, thanks for that question, Janelle. Yeah, I mean, the variety of leveraged funds that were secured was just very, very impressive. And I mentioned a few of them, like state health departments that found other state resources. Another example of that is one of the SPAN recipients. They got state dollars for a program called Revitalizing Main Streets. And that actually funded infrastructure improvements in communities to make walking and biking easier. So they didn't actually, the SPAN program didn't have to pay for that. They had found another budget source to do that. Or one of the HOP recipients, they also leveraged funds through the Gus Schumacher Nutrition Incentive Program to get SNAP dollars matched at farmers markets. So that was another example of an outside source of funding. So lots of outside sources of funding that were secured that were just very, very impressive and creative.
Thank you. Next question for Yolanda. What are the most important factors for starting a bike share program?
I would definitely say first, just making sure you engage your community and checking for readiness as well. A lot of times we're so quick to just, because we're so excited, we want to get things done for a community that we never really take the time to see if they're even ready for it. And we don't take the time to see if they even want it. If you get them on early on and they want the program, then sustainability is going to be there, and because they're going to want to do it. Accountability is going to be there because they're going to want to do it for their community.
Thank you. Catherine, a question for you. How do we know this will work and be sustained now that the cooperative agreement has ended?
Yeah, thanks, Janelle. I would say, of course, we can never know for sure unless we show up to every site and test all their food, but sustainability is baked into the nature of guidelines. Passing a food service guidelines policy as opposed to, programming or other types of efforts really integrates the practices into the procedures of that institution. That being said, I do want to mention, I think it's extremely important to integrate key players at the institution, such as leadership, food service staff, procurement staff, janitorial staff, the actual eaters at that organization, and more into the process from the get-go, from the very beginning. That's important not only to craft the guidelines in a way that works for the institution and its eaters, but also gives ownership over the policy and its implementation. It's not just something, us as an outside group comes in and says, hey, you should pass this. It's a good thing to do. It's actually their policy. Also, at the end of the last cooperative agreement, we worked really hard near the end to connect all of those organizations with ongoing support that had aligned goals and capacity to keep helping. Like SNAP-Ed is a great example there.
Thank you. Michaela, a question for you. What are some challenges of opening lactation spaces, particularly in areas such as the airport?
Well, there wasn't really, I think, like, for me, it was the challenges where there's a lot of different community members that we have to have into contact with and reach out to just to have their voices heard. So a lot of the roundtables that we spoke, I'm like, for instance, the breastfeeding room, they didn't have an outlet next to the chair. So that was something that we had to work to implement. But the Port of Portland was actually great to work with, and they were really accepting of all of our the evaluation and recommendations we made. So we didn't really have any barriers. I think right now it's just working on our communications campaign and finding areas within the Port of Portland that we can place those images that are going to have an impact on travelers as well as the employees of Port of Portland.
Thank you. Well, we're nearing the end of our time. I want to ask each of our speakers today if they have like a final thought they want to leave our audience with. So Terry, I'll turn to you first.
Well, thanks, Janelle. I think what I would say is, and what you heard from our presenters, in order to adequately address these risk factors, we're in the face of long-standing systemic inequities, and we've got to confront those. And often the most underserved groups are the ones that have historically suffered risk factors disproportionately. So not only identifying those policies that you need to have in place, but also the people that you need to work with and partner with. And those partnerships are key. So patience, flexibility, and even some grace, I think, is warranted. And I think that's something to keep in mind if you want to do this kind of work.
Thanks, Terry. Anu?
Thanks, Janelle. Yeah, I mean, really when we look at these numbers, the ability to leverage $400 million additional dollars and reach over 28 million people, really, it was just astounding. And we were just blown away by what just 16 SPAN recipients, 15 HOP recipients, and 40 REACH recipients could accomplish. And so I invite you all, Terry mentioned earlier, supply and demand are not matching right now. So I invite you all to visualize what more could be accomplished in our country, if all 50 states and if all eligible and interested universities and community level organizations, if they were all funded to do this critical work, and just where we could be as a nation. So I just am so proud of what everybody has accomplished, and also would love to envision a future in which more could be done.
Thank you. Catherine?
Well said, those who came before me. I think the only other piece I would add in the food space is just like much of the work that we all do and you all on the phone do, this work really can't be rushed. And one element that I wasn't so much able to touch on, but I think is critically important, is that we were able to take the time to hear from the eaters of the organizations directly and integrate their feedback into their food service guidelines policies to different degrees. So I think one piece that didn't fully come out is that now not only are there more health supporting foods being offered throughout Illinois, but those foods are also more culturally responsive and delicious for those particular eaters consuming them.
Thank you. Yolanda?
I would say that my final thought would be, no matter the project, the intervention that you're doing, please don't forget to give the people you're doing it for a seat at the table. Engage them in the beginning, and I stand on that.
Thank you. And Michaela?
Yes, thank you, Yolanda. And going off of what Yolanda just said, I think mentioning your partners and giving them the floor, always their voice should be heard first. And, promote nutrition starting from the breast, always. And happy Black History Month.
Thank you.
Yes, thank you.
Thank you. Well, what a great session we had today. Thank you all for joining us for this. This will be posted on the CDC website. So if you want to come back and hear some more of the great examples that you heard today, it'll be there. Or if your colleague missed it and you want them to check it out, we'll have it posted. So thanks for joining us, and we look forward to seeing you at the next seminar. Goodbye.